We're asking about those so-called breakthrough cases because our state continues, of course, to see a COVID surge. We added another 51,000 cases yesterday, according to CDC data, which really isn't much of a surprise as we also continue to see those long lines at testing sites. Just under a third of those tests are coming back positive. The good news you can see here is the state is not reporting any new COVID-related deaths in the latest data. And hospitalizations among adults, at least, are on the decline. But one trend where doctors say they are seeing an increase is the number of children who are testing positive and in some cases are being hospitalized. Our Emerald Morrow spoke to doctors about why they believe it could be a while before those numbers start going down.
We are nowhere near the peak of the surge, in my opinion.
And that has parents like Anita Benson terrified. All three of her young children had COVID.
It was very stressful.
She worries with her kids back in class, it's only a matter of time before Omicron strikes again.
Even with the schools, I called them every morning, make sure my kids keep on their masks, only pull it down to eat and drink.
Just as much as parents are worried about COVID in the classrooms, doctors are worried about keeping those kids out of the hospitals, especially as cases rise.
For the week ending Sunday, we had 38 kids test positive for COVID. In the previous week, we only had 4.
This increase at Johns Hopkins All Children's Hospital in St. Pete mirrors a nationwide trend. Doctors say they hope children don't get lost in the overall numbers.
The case numbers went up so fast that I think that the adults are going to kind of drown out the kids and push them into a smaller percentage, which can be a little misleading because the case number total for the kids is actually going up.
Nationally, doctors say they find many pediatric COVID cases when kids come in for something else, but at All Children's, it's a different story.
Most of the children who've tested positive were brought in because they had some symptoms and the parents were concerned that they might have COVID.
So while Omicron might be less severe in some cases, doctors say it can still take a toll on those little bodies.
We see the children who are so sick that they're on a mechanical ventilator because their lungs can no longer oxygenate their blood properly. We unfortunately have seen some of the children who don't survive the COVID.